Thank you so much, David, for leading that break. I'm looking forward to your return this afternoon. Our veterans can face many barriers when it comes to accessing care. Knowledge, availability, and eligibility are just some of the barriers they face. One of the greatest challenges to increase access to health care, however, is transportation. Many veterans face a wide range of transportation challenges: not having access to personal or public transportation, relying on a caregiver who may be unable for recurring medical appointments, or living in rural areas where transportation is limited. Our next session will showcase what VA is doing to address this critical barrier. To begin this conversation and introduce our first round of panelists, join me in welcoming Bryn Cole, Director of Design and Storytelling for VHA Innovation Ecosystem.
Appreciate it. Hello, everyone. I want to introduce the next session not with names and roles first and foremost, but with 4 stark facts from the American Hospital Association. 1, every year, 3.6 million people in the United States do not obtain medical care due to transportation issues. Number 2, transportation is the most commonly cited barrier to accessing health services for older adults. 3, overall, individuals who are older, less educated, female, persons of color, or low income, or have a combination of these characteristics, are affected more by transportation barriers. And 4, children, older adults, and veterans are especially vulnerable to transportation barriers due to social isolation, comorbidities, and greater need for frequent clinician visits. In the next hour, you'll hear from 2 separate teams who are leveraging rideshare in unique and innovative ways to help shift these facts into eventual fiction. Indra Sandal and her team are first leveraging a partnership with Uber under VA beneficiary travel regulations. After that, we will have a special pop-up episode of C20, if you know, where Chai Chad interviews rideshare innovator Charles Franklin, who has leveraged and grown rideshare service provider agnostic outside the boundaries of Benny Travel. But first, a quick video to help illustrate the VA-Uber partnership, and then our first panel will take the stage.
My name is Indra Sandal. I'm an innovation specialist at Memphis VA Medical Center, Tennessee, and I'm also a national lead for the VHA Uber Health Connect initiative and the VHA Executive Management Fellow for this year.
So VTP's collaboration with the VHA Innovation Ecosystem really started by an idea from my co-lead at the Memphis VA Medical Center, Indra Sandal.
I took this national initiative to solve the transportation barrier for the access for care for our 9 million veterans. And we worked almost 1 year with the program office, with the Uber Health, and also with the VHA Innovation Ecosystem, a lot of the VA hospital, and finally we created a partnership between the VHA and the Uber Health rideshare services.
There have been a number of documented challenges for veterans accessing VA healthcare services. Transportation is one right up there at the top.
In 2017 study showed that 1.8 million missed appointments, which happens every year in the VHA facilities, is because of the transportation issue.
From an operational perspective, is this takes some responsibility from us internal to the organization that allows us to focus resources in managing other programs. This is very efficient, as I understand it as well, internally to the operational impacts.
Uber Health is just another tool to help assist with some of the veterans that need to get to their VA appointments that may not have been able to get there before.
The program is helping meet the needs of our veterans who are ambulatory, do not fall into the category of special mode transportation.
The Uber Health Connect allows us to have a much higher level of convenience to the veteran without the same type of inconveniences that come with our current system.
Actually, without access, healthcare is almost meaningless. And so without transportation, it's all for naught. And so that's why this is so incredibly important for us. In our particular network, we not only have urban areas, but also rural areas. And therefore, transportation is a critical issue for us.
So what we did in the pilot, we did take a lot of the rural population because we wanted to learn the lessons that how we can take care of that. So one way they took care of it that they used their existing transportation for the far area and open the resources for the veterans who are close by with the ride share.
So for us, we saw an opportunity to provide a reduction in traffic, getting our patients to their appointments safely. It freed up some of our VTS mobility opportunities to tap more into the rural areas.
Just because they may be a rural area does not mean Uber Health cannot assist.
And if they live in an outside community, such as 20 or 30 miles away from the VA medical center itself, there may be very little public transportation. So this helps fill that gap for them to be sure that they access healthcare.
We are trying our best to make sure that this facility and this service should be available to each and every veteran wherever that person might be.
At this point, it can do nothing more than grow. As the word gets out, more veterans become aware, more veterans know that it's available, and it's another tool in our belt to use.
And so if through this program, say we're able to trim off 30-40% of that cost, right? That's monies that go right back into the medical center.
We can, work with each site and each within each VISN and make sure that what we're doing for these 10 hospitals today can be expanded to the hundreds more that are available.
We presented this initiative to other VISNs. So we presented to 7 VISNs. And as a result of which, at this time, we have 45 VA hospitals which are going for a pre-launch by the end of this year. And in January, we are launching in 45 VA hospitals. Again,
Good afternoon, everyone. My name is Indra Sandal. I'm a national lead for the VHA Uber Health Connect initiative and also the innovation specialist at the Memphis VA Medical Center, Tennessee. And to start the whole conversation with our panel, I want to give you a little bit of an idea, and I think so you already saw in the video, that how big is the transportation for the barrier for the healthcare access for our 5 million veterans living in a rural and the urban areas. And as I mentioned earlier, that the study showed that 1.8 million missed appointments, which happens every year in the VHA facilities, is because of this, and which cost agency $4.4 billion. And the most important, that it impacts the health of our veterans. So I took this effort to see that whether we can solve this problem, which is such a huge problem for the access to care, to the VHA Innovation Fellowship Program. And I became a VHA Innovation Fellow in 2021, and since then, this VHA Uber Health Connect initiative was born. So here we are in the panel today, have all the stakeholders, not all, but few of them, with whom we are going to discuss about this initiative and how this is bringing and creating a value to our veterans, to the caregivers, and also for the VA hospital. So I will let them introduce themselves, starting with Ben.
Thanks, Indra. My name is Ben Williams. I'm the director for the Veterans Transportation Program and the co-lead for the VHA Uber Health Connect initiative.
Mike.
Yeah, hi, good morning. I'm Mike Renfro. I'm the Deputy Executive Director at VA's Tennessee Valley Healthcare System.
Great. And hello, everyone. My name is Caitlin Donovan. I'm the Global Head of Uber Health, and so pleased to be here today.
Oh, thank you so much for having to be here, and welcome to you all, and let's start. So before we'll go into the detail about all these challenges and the access and where we are, let's talk a little bit about that, as I mentioned about my journey in this space, how I started, how your journey started in this VHA Uber Health Connect initiative. I will let Ben to start with.
All right. Round about December 2020, got an email from Indra saying, "Hey, got an idea. Want to explore this space." And from there, it was we needed capacity. It was just a really natural fit. So we started jumping into figuring out from the regulatory and legal barriers, can we do this? And then once we passed those hurdles, it was how can we do this from a process perspective? And we began analyzing, who are our potential collaborators in this, and that's where once we did that analysis, we got enter Uber Health. And then from there, working with the facilities, garnering buy-in from the leadership, developing a process, the use cases, so forth and so on, and then got to the point where we kicked off in January 2022, and here we are today.
What about you, Mike?
Yeah, so I've known Indra for quite a while now, well before this innovation specialist stuff. And about 2 years ago, I got a very similar email. At that time, I was the deputy director of the VA Patient Experience Program, and Indra was interested in how transportation was impacting veteran experience overall on the healthcare side. So did a little bit there, and then fast forward to about a year ago, I moved down to Nashville to start the job at Tennessee Valley, and lo and behold, we were a pilot site. So got to see it from the veteran experience perspective, huge impact on the access piece. And then now, about 10 months into this pilot in Vision 9 at Tennessee Valley, get to see it from the operational perspective day to day in the healthcare system as well.
What about you, Caitlin?
Great. So I think everyone else started about 2 years ago, but I've only been at Uber Health for 18 months. So I was lucky that this initiative predated my time, and what a great initiative to walk into on my first day at Uber. Historically, I think that the marriage between technology in the private sector and the process that Ben and Indra were talking about is so critical to make sure that you're truly tackling the issues at hand. And so thinking about how our technology was built with process in mind and the people that were using it in mind, meaning transportation coordinators, care coordinators, discharge planners, it really allowed us to work together on, the VA knowing the process that you need to use and marrying it with the technology that Uber Health had.
Yeah, that's so interesting to know that everybody has a different way that how they got involved into this. But I'm so happy that we all are working together. So let's come to the major, the most important question, like access, right? So how does the VHA Uber Health Connect initiative is helping our veterans to basically to get the access to care where they want, whether it is in the VA hospital or whether it's in the community care. So I will maybe start with Ben to a little bit, or maybe let's start with Mike from the VA hospital point of view. Little bit a curveball. Otherwise, we'll be not all little bit off script. Okay, so let's start with Mike, and then maybe from the VA hospital point of view, shed some light that how this initiative is helping our veterans and improving the access to care to them.
Sure, well, I'll do a curveball too. Show of hands, who's ever used Uber or rideshare? Okay, I'm glad you raised it. That would be very strange if
I also used.
You hadn't. So it's easy, right? Very easy, so it's easy for our veterans to use it. I think that's first and foremost. And second, it creates access where access doesn't exist. So from the veteran perspective, the data clearly indicates that veterans want to choose VA and get their care at VA. But if you're in Tennessee Valley, like I am, which extends from southern Kentucky to Chattanooga, there's a ton of space between there where there's frankly not that much. And so that access issue could be the deciding factor on whether that veteran chooses to get the care within the system or goes somewhere else, especially when it comes to specialty care, procedure type stuff where they've got to come to one of the two main hospitals. So the veteran piece is important. From the operations side, also critically important, we have transportation gaps that we need to fill. The missed appointments thing is huge in VHA and has a ton of second and third order effects in the system. So this is a win-win for both. Just to give you a little bit of scale and scope, across the 10 sites in VISN 9 and VISN 15, we've done about 15,000 rides this year so far for about 3,000 veterans. So that's a huge, huge impact. One site, for example, was able to see a reduction in 1,000, so 1,000 bed days of care by being able to expedite the discharge process, get veterans out. Now that impacts that veteran, that's the immediate veteran that needs the transportation, but also allows us to increase throughput in our EDs or repatriate veterans from community hospitals because we've freed up beds. So it's a win-win for both.
And it's so good that you talked about the success of this pilot, right? It's only 10 months. But we are still facing so many challenges. And it might be for the future also, and also when we are going through it. So I will ask Ben to a little bit talk about, from the program office point of view, while working through this initiative, what challenges we are coming across in regard to the demand of filling these rides for our veterans. And give us a little bit of insight that it's not only that what challenges we are going to face after pilot, but also during the pilot, what are the challenges we are facing?
Sure, thanks, Indra. I think break this apart into two pieces. One's the demand and the variation of different needs. And then the second part being how are we fitting this and being efficient with how we design a process and plug it in to our existing infrastructure and at 150 or so or more, depending on who's counting, VA medical centers. So the first one, demand, we know that 56% of our veterans are rural and or over 65 years of age. We know that 6% have no access to a vehicle, 11% don't have a driver's license. So the different needs are coming in from an abundant different places. Also, we have a really, really good mix of veterans who live in urban and suburban areas, but then also the rural aspect that I mentioned. So taking those pieces and figuring out how we apply based off the demographics at each of the medical centers and educate that staff, not just the transportation staff, but the critically important staff that are the social workers or the providers to know that this service is available for the beneficiary travel eligible veterans, and it should be something that we're utilizing as broadly as possible. So that's some of the challenges from a demand perspective. Then from just a process integration perspective, so we have this particular process for one portion of beneficiary travel, which is the ride share. We also have third-party contract providers that provide special mode transportation and other transportation requirements. And then we have our in-house service. So how do we fit making the best decision for that veteran based off what capacity exists and what's most efficient for the agency from a resource perspective? That's the other challenge that we have as we go through this pilot and we come out the other end. How do we, when we broadly deploy across all of the facilities, how do we best package that up and deploy that and make an efficient and effective process, not just for the veterans, but also for the facilities?
Yeah, you brought a very good point, and I think so I will let Caitlin to chime in here, that from the Uber Health point of view, how you are addressing all these challenges while we are going through the pilot and also for the future.
Yeah, I think it's really important to think about, as Ben said, the process around using this tool so that it's not a blunt instrument for use with everyone, but you think about the appropriate decision tree. When is the right time to use Uber? When is the right time to use another modality? And so when we think about building our technology, we think process in mind. I was very glad to see that almost everyone in this room has used Uber, but Uber Health is a little bit different, right? Because the things that you might need as an individual consumer are not the same things that you'd need at a VA medical center. You need to know with guarantee that a ride is going to show up, even if that veteran's coming from a rural area. And so when we think about iterating on our technology in partnership with the VA and Indra and Ben and Mike, we think about how to build those tools so that we can give visibility and enable the process that you need to use to make the right decision for the veteran. Very specifically, we think about exposing a supply predictor. What is the likelihood that this ride is going to show up so that you can take advantage of Uber's unmatched network of independent drivers that does extend into rural areas? We think about how do you empower a veteran that may not want to use their data on their phone to download an Uber app? How do you empower them to use text messages to request that Uber ride in real time? So we have a feature called Flexible Rides that allows a veteran to press the number 1 and have the Uber show up at their convenience versus waiting for a transportation coordinator to call a ride on their behalf. And we think down the road of how do we leverage our technology in partnership with the VA to, like Ben said, further integrate what those decision trees look like so we can scale out further and further into rural areas to address more and more of the problems for veterans.
Thank you, Caitlin, for bringing up that stuff. And let's talk a little bit from the veteran experience, all right? We are doing everything from the cost saving, from the access and everything. But how important is the veteran experience, which is the key thing for this initiative? So I will let Mike to a little bit shed light on that. That do veterans value that the medical facilities can decrease the burden on them by scheduling their rides, using the rideshare service? A little bit of insight being you in the front line.
So actually, before I answer that, I completely forgotten that our very first ride at Tennessee Valley was from Nashville to northern Alabama, which is about 100 miles south of 65. So this was a veteran who had no way to get home. And then hearing the two of you talk about the rural aspect of this hits home the importance of being able to take veterans, particularly in large catchment areas. But to answer your question, yes, there is value, and veterans have, they rely on all of our transportation services for their appointments, and like I just mentioned, to get as far south as Alabama. So the experience piece is critical, but the healthcare piece is critical as well. And so people that don't come to the doctor because they can't get to the doctor get sicker. And there's data to validate that even within VHA. So there was a study looking at data in VHA from 2013 to 2017 on missed appointments. And what they found should not be surprising, but if you miss your appointment, there was a correlation between missed appointments and things like higher readmission rates post-discharge, higher mortality rates, things like poor pain management for veterans that have chronic pain management, decreases in early detection of cancer for patients. So a whole host of issues that are detrimental to the veteran and also cost the health system more money on the back end from delaying that care. So getting folks in early detection, early treatment is the goal, because I think our collective goal is to keep people out of the hospital and keep them healthy. And so transportation is a huge, huge part of that. So just in Tennessee Valley alone, in addition to our first one down to Alabama, in the last 9 months, we've given about 3,000 rides to veterans. That has resulted in us avoiding 2,800 missed appointments, which certainly impacts the veterans' experience and care, but also clinic operations for clinics that have blocked that time for that particular appointment, and saved us about 270 bed days of care, which I don't know about you all, we are full every day, and the last year has not been any better. So getting them out, getting them timely, and I always think about a veteran who's sitting in a bed trying to get to Alabama, waiting for a son, daughter, spouse, whoever to be able to take off work and come get them. And there are just all these second and third order effects that are even deeper into this. So yes, they do value
Yes.
it. Yes.
I
It's a
got
long
it.
yes.
That's very interesting, and I think so. I'm seeing the clock here. So let's move on to maybe the last question, and I'm very sure Ben, you can add it a little bit there. How we are collaborating with the VEO and also for the vet techs for learning the veteran experience, and maybe I will cover it in my wrap up. So let's talk about maybe in few words, each one of you can explain within like 10 seconds, seeing the clock, that what value this private-public collaboration is bringing to the VA and especially for our veterans. Start with Caitlin.
Yeah, so from my standpoint, I think you said it so well. The ultimate goal is to improve quality of care and save cost to the system while promoting better outcomes. And to do that well, you need the combination of local knowledge and process with technology. And I'm thrilled to be a part of this initiative.
Thank you, Caitlin. What about you, Mike?
Access, ease, effectiveness.
Oh, good. Thank you. You gave 5 seconds.
There you
What
go.
about you, Ben?
From a narrow-minded transportation focus, it's about creating capacity and then getting the best tools. I mean, it's no secret the private sector has the most fun tools and the most advanced tools, and we need those to do better.
Okay, thank you so much. So we are going to wrap up and go through a little bit a quick slides so that you can take home message for this program. So can we have slides? Yes. So the VHA Uber Health Connect initiative, and these are something which I want everybody in the audience should take it back to home, because this is going to come to your VA very soon. And one of this is that this is a collaboration between the VHA and a Uber Health rideshare service. It's not a contract or a contractual agreement, and there's no administrative fee which we are paying to the Uber Health. Second thing important, which we didn't mention here, that this is only available for the beneficiary travel eligible veterans at this time, and only for the medical appointment. So we are not doing anything other than the medical appointment. Third piece, which is really important, is the modernization of the transportation system, where we integrated the HIPAA compliant technology of the Uber Health into the existing transportation system so that we can have a centralized dashboard and the mobility managers can schedule the ride, track the ride, basically pay the invoices, have a 24/7 support system from the centralized dashboard. And that will make a very easy life for the mobility manager who are working frontline. The most important piece, which I want everybody to maybe listen it very well, that we don't need additional funding for this program, because all the VA hospital has allocated funding for the beneficiary travel eligible veteran. So that is another piece of it. And as you can see, what was the goal for us is to reduce the no-shows and also to improve the veteran experience, and in the end, how we can save the cost saving for the VA hospital. So these are the quick numbers which you can see that how we are doing in our pilot and how much cost saving we had for the VA hospital and how the veteran experience is playing a big role here. And these are some of the testimonials from the veterans. When we interviewed them who did the rideshare services, they are really, really overwhelmed with that. So my time is up, but thank you so much for everyone for listening to us. And thank you to all our mentors and the advisors and sponsors. It's a huge army behind this initiative. And especially in the audience, we have our sponsor, the Executive Director of Member Services, Garth Miller, who is here to support us. And thank you to him. And thank you to the OHIL leadership and the VHA Innovation Ecosystem for giving us and featuring this program 2 years in a row. So we hope that the next year we will come back again with the more things to say, and also for when we are going to expand in the 60 VA hospital. So thank you everyone for listening, and we will see you there. Bye-bye.